palmar
terms, yes, we're looking at the anatomical terms. Still, we're not in movement. We'll do movement soon. I'm not sure if it's... Oh, yes, it's pressed. Good. Yeah. Okay. So, most easy one is anterior and posterior. Here, anterior is in front of, right? And it relates to the whole of the body. Yes? Coming to the back. So you should look for the posterior. Yeah? Can you do it with me? Yeah? So anterior and posterior. Good. Come back into good. Next one is pretty much the same, but used only for the torso. Torso or the trunk is just the area from the shoulder to the hip. It's like the major bit in the body. So we call it torso or trunk. So ventral. Yeah. Ventral is just in front. And dorsal. Yeah? Ventral and dorsal. Then medial and lateral. Medial is close to the midline of the body, which is just an imaginary line in the center of the body. So medial and lateral could be medial and lateral, or medial and lateral, or medial and lateral. As long as you have these, one goes one way, the other one goes the other way, you're fine. So medial and lateral here on the shoulder. Yeah? Good. Then external and internal. So come and turn this. External is away from us toward the skin, and internal should be somewhere here, yes? Or deep. Yeah? Good. Where is the rest? Oh, we don't know. Oh, okay. They didn't put. So internal as superficial. Sorry, internal as deep, and external as superficial. So skin and bone, which one is more superficial? Skin. Skin. Good. Which one is deeper? The bone. Yeah, good. How is it above and below? Now I feel superior and inferior. So we have to look. Inferior here and superior. Oh, here on the glasses. Wonderful. That's good. I should be careful. Good. Good. So this is a simple superior above, inferior below. Yeah, it's quite used in English also. Yeah, but in different connotation, in social connotation. What are we doing now? Proximal and distal. Proximal is closer to the center of the body, to the trunk. So proximal and distal. Or distal and proximal. Yeah? So closer is proximal, away is distal. And also in the limb. So let's use it in a connotation. Yes? Which one is more distal? The ankle joint or the knee joint? The ankle is distal to the trunk. Yeah? Which one is more proximal? The shoulder or the wrist? The shoulder is more proximal. Yeah? Good. So proximal and distal. What do we have now? Everything in here? Yes, good. Now we're getting to the more problematic ones, yes? So supine and prone on the forearm, taken from anatomical position. So supine is in front, yeah? And prone is on the back. Good. Now on the feet and arm, on feet and palm, yeah? So dorsal surface is the heartbeat. Can you feel it? Yes, the heartbeat. Yes, and on the feet is the heartbeat also. Yeah, makes sense, right? So these are the easy one. Dorsal here on the heartbeat, and yeah, so. And then on the palm is called palmar surface, and on the feet, plantar surface. So most of it makes sense. You might need one or two to learn. Yeah. Yeah. Did I forget anything? Wonderful. Good. Any questions? Good. Let's move on then. All right.
You have to be clear and place your hands and move it closer to your other leg. Move it closer, yeah.
It's a test of his balance, isn't it? Yeah.
Is that extension of your right leg? What is extension of your right leg? Then what is flexion of your right
Could you help us?
She hasn't moved yet, has she? Which one are you doing?
This one, yeah.
We can start with this. Go in this position.
You're right there, Lisa.
Could you help us?
Yeah, by this abduction, by this
Cranium. What is the standard English name from cranium? Skull. Good. Now a jaw. What is this is a standard name, mandible. Good. However, there is another name for the upper jaw, which I don't think you need to know because it does not move. It's called maxillae. So mandible. Yeah. Then we go on to the back, and how does the neck area called? Cervical spine. Yeah? Good. And now after that we learn that it will have 7 vertebrae, and the top 2 vertebrae is atlas. Atlas is really the top vertebra, and the atlas does something interesting. If this is the skull, the atlas is just a ring of the vertebra, first vertebra, and the head is sort of balanced. The whole skull is balanced on a ring of the vertebra. So interesting features. And after that is the axis. Yeah, C. So it goes by the number C1, which is the top cervical vertebra. C is for cervical, and C2 is the axis. Now, on the back there is an important bone called occipital bone. And the occipital bone is where the neck and spinal muscles attached all the way to the bone itself. It has interesting ridges because these muscles are quite strong. Now, these muscles, they do this movement. Do you remember how this movement called? Extension. Remember, it's the opposite of the flexion. Okay? So when these muscles, the neck muscles attached to the skull, get stiff, this is where tension headache or stress headache can sort of spread and create headache. Yeah? That would be one way of spreading of headache from stress. From the front, those two bones, the standard name is collarbone, and the anatomical name is clavicle. Yeah? By the way, these bones are quite prone to fracture. Quite prone to fracture because when you're falling on your hand, the whole hand can be locked. So the weaker bone, the taking the toll from the fall is the clavicle, and they are, you know, breaking once in a while. Chest bone is the standard name, and what would be an anatomical name? Sternum. Sternum. Good. Ribs is a standard name. Do you know what would be the anatomical name for ribs? Do you remember?
Sternum.
In costal.
Oh,
Costal. Yeah. But never mind, it's not important. Oh, rib 12.
Intercostal is the name of the muscle that is in between the
Yes? Yeah? Floating ribs. Why they're floating? Because they're not attaching below. Yeah? Shoulder blade. What is the anatomical name for shoulder blade? Scapula. Scapula. Good. Good. Thoracic spine. What make the thoracic spine differ from the neck and the lumbar?
It protects the ribs. It protects the chest.
It protects the chest and
Next to the ribs.
and yes, so the thoracic spine, each vertebra would have ribs attached. Do you see? The neck doesn't, and the lower back doesn't. Lumbar area doesn't. So neck quite movable, lower back quite movable, thoracic a lot stiffer because the ribs don't allow it. It's quite stiff. Okay? Lumbar area, yeah, or lower back. Yeah? Keep on the spine, sacrum, and coccyx. Good. Now let's go on to the upper limb. So, scapula we had. The arm bone. How do we call the arm bone? Humerus. Humerus. Good. And what's the name of this area? Forearm. So this is the arm, and this is the forearm. And it has two bones, radius. Remember what did I tell you about the radio of the antenna? Yeah, antenna of the radio. So this is the radius, and the ulnar is on the other side. And now this is the carpal bones. What's the standard name for this area? Wrist. Good. And what's the standard name of that area? Palm. And what's the name of the bone there? Metacarpals. And then phalanges. Yeah? And then phalanges. How many phalanges we have for each finger? Is it correct for all?
No.
Which one has? The thumb has two. Yeah? So the thumb has two, and the other bone, yes, 1, 2, 3 phalanges. Good. A spinal disc. Yeah? Good. Spinal disc is like a cushion between two vertebrae. And now we are on the hip. So hip is a bit confusing because it has one bone that has 3 names. And what I mean is the hip bone. bone is made up of actually 3 separate bones that in 2 years old, they're all fused together. So the top one called the ilium, yeah? The lower one called the ischium, and the front one called the pubis, yeah? So that's the area. Now there are few specific area, like on the ilium, you have the iliac crest. And the iliac crest is that crest. And you know what happened here? That the muscles from the spine coming and attaching to here. So it's nice to feel it. So feel it and to feel how tight it is. And the muscles of the abdomen attached here. So it's quite a nice muscle attachment, and it's nice to be able to palpate it, to feel it. Sit bone is that point that stick downward, and it's part of the ischium bone. So it's called the sit bone. Right. What's the name of the thigh bone? Femur. Remember, Rasa, you've done it? Femur? Yeah? And what's the name of the kneecap? Patella. Good. Kneecap, patella. And then, who did that? Manel, right? What's the name of the shin bone?
Tibia.
Tibia, good. And the small one here? Near the tibia? Lateral to it? Fibula.
Oh, fibula.
Fibula? Quite superficial?
Yeah.
Yeah.
And I always remember it like that. When
Right.
I was to
Yeah. It's like creative thinking. You try to make sometimes a joke out of it, sometimes you try to make something different that maybe in your own language, that, or you try to find something that is unusual or usual, so then you learn it, you know? So, right, heel bone. What's the name of the heel bone? Calcaneus. And what's metatarsals and phalanges, right? What's in here? Calcaneus, yeah. Tarsal bones and phalanges. Good. Great. Wonderful. That's quite quickly, yeah? And just repeating and not, I could let you sit and then you could sort of, listen to me and then thinking, okay, my blood is down, and so that's also important when you're doing it at home. Try to watch videos. Try to cut it again and do it at home. It's a lot better than reading the book. You should read the book, but only once, and then get what you don't understand, and then try to be active. Meet with each other. It's always nice to get it. Even if you finish at 6 o'clock, you can meet someone even in a restaurant or in a cafe, and then get it going, do 2 hours of it, and then, yeah, keep yourself interested. Great.